It's one of the most common questions I get in my office. A patient, usually someone I've known for years, sits down, looks at the paperwork in their hands, and asks me, "Doctor, do I really need to do this again?" They are holding a referral for a colonoscopy, or maybe an order for a stress test, and they look worried. Not because they feel sick, but because they feel fine, and they're terrified the test itself is going to change that. If you are over the age of 70, this situation probably sounds familiar. You go in for your annual wellness check, feeling great, maybe planning a trip to see the grandkids or working on your garden. Then, almost automatically, your doctor starts ticking off boxes. It's time for this screening. It's time for that scan. It's time for a procedure that requires fasting, anesthesia, or radiation. And if you hesitate, you might feel like you're being reckless with your health. But here is the truth that very few doctors will tell you outright. Just because a test is routine doesn't mean it is right for you. In fact, after you turn 70, some of the most commonly pushed mandatory tests can actually do more harm than good. Today, we are going to have an honest conversation about why that is, and I am going to walk you through the 3 specific tests you should think twice about before agreeing to. Let's start with the big picture. Why does everything change after 70? It's not because your value decreases. It's because the biology of your body changes and the mathematics of medicine shift. When you are 50, screening for a slow-growing cancer makes sense because you have 30 or 40 years ahead of you where that cancer could become a problem. But many of the conditions we screen for grow incredibly slowly. If a test finds something when you are 75, it might be something that wouldn't have caused you any symptoms until you were. By treating it aggressively now, we might be subjecting you to surgeries and side effects that ruin your quality of life today, to prevent a problem that wasn't going to affect you anyway. There is also the factor of fragility. I hate that word, but it's medically important. As we age, our bodies don't bounce back from invasive procedures the way they used to. A colonoscopy isn't just a camera. It involves powerful laxatives that can dehydrate you and anesthesia that can fog your brain for weeks. A biopsy carries risks of infection or bleeding that are much higher when you are older. So, what are these 3 tests? Let's dive into the first one, the routine colonoscopy. For decades, we have been told that the colonoscopy is the gold standard. And for a 55-year-old, it is a lifesaver. But let's say you are 7, you've had clear screenings in the past. You have no family history of colon cancer. Yet, the automated system at your clinic flags you for another one. Here is the reality. The risk of a serious complication from a colonoscopy, like a perforation of the bowel, increases significantly with age. I have seen healthy, active seniors undergo a routine screening, only to end up hospitalized with complications, setting off a chain reaction of health issues they never recovered from. If you have had normal results up until now, the American College of Physicians actually suggests stopping these screenings after 75 and having a serious discussion about stopping them after 70. If you are asymptomatic, the risk of the test often outweighs the benefit of what it might find. The second test is the PSA test for prostate cancer. This one is tricky because it's just a blood test, right? It seems harmless, but the PSA test is famous for what we call false positives or identifying insignificant cancers. It often flags slow-growing cancers that would never actually harm the patient. But once you see that elevated number, panic sets in. That leads to a biopsy, which is painful and carries infection risks. If cancer cells are found, it often leads to surgery or radiation. The side effects of prostate treatment, incontinence and impotence, can be devastating for an older man's quality of life. I have had patients tell me they wish they never knew about their slow-growing cancer because the treatment stole their vitality years before the disease ever would have. The third test might surprise you because it relates to your heart. The routine cardiac stress test. Now, if you are having chest pain, this is a different story. But I am talking about the just-in-case stress test often ordered before a minor surgery or as part of a general checkup for active seniors. These tests often produce false alarms in older heart. A shadow on a scan or a minor irregularity can lead to an angiogram, which is invasive, or even stents that recent studies show don't prevent heart attacks any better than medication in stable patients. You end up with a procedure you didn't need, taking blood thinners you didn't want, all because of a test that was ordered out of habit rather than necessity. So why does this keep happening? Why is your doctor pushing these if they are risky? It's rarely malicious. Usually it is momentum. Medical systems are built on protocols. The computer system flashes a red warning if a screening is overdue, and doctors are pressured to clear those warnings. It is faster to order the test than to have a 15-minute conversation about why you don't need it. Frankly, we have to talk about the economics of it. Healthcare is a business. These procedures, colonoscopies, surgeries, heart interventions, are major revenue generators for hospitals and clinics. There is a financial incentive embedded in the system to keep testing and treating, even when the science suggests we should stop. You might be wondering, what if I refuse? Will my doctor be angry? A good doctor won't be. A good doctor will be relieved to have an informed conversation. When you go into your next appointment, I want you to feel empowered to ask questions. If a test is suggested, don't just nod. Ask, how will the results of this test change my treatment? If the answer is that it won't change anything, or that it would lead to treatments you wouldn't want anyway, then the test is unnecessary. Ask about the number needed to screen. That is a statistic that tells you how many people need to undergo a test to save one life. For many of these tests in the over 70 crowd, hundreds of people have to be screened and exposed to the risks of screening to prevent one single death. You have to decide if you want to be one of the hundreds taking the risk. Another great question is, what is the false positive rate for someone my age? You deserve to know the likelihood that this test will scare you for no reason. And finally, ask, if we find something, is it likely to affect my life expectancy? Or will I die with this disease rather than from it? That sounds blunt, but it is the most important question in geriatric medicine. I had a patient named Robert, 78 years old, who loved golfing and walking his dog. He was pressured into a prostate screening that led to a cascade of interventions. He spent his 79th year in and out of urology clinics, dealing with infections and recovery, unable to walk his dog or swing a club. He told me later, I traded a good year for a bad year, and I didn't even buy myself any extra time. That is what we want to avoid. Your health after 70 isn't just about living as long as possible. It is about living as well as possible. It is about protecting your energy, your mobility, and your peace of mind. You have the right to say no. You have the right to prioritize your current quality of life over hypothetical risks. So the next time you are in that exam room and the topic of mandatory screenings comes up, remember that mandatory is just a word on a form. You are the boss of your body. You can say, Doc, I've had a good run of clear tests, and at this stage in my life, I'd rather focus on maintaining my wellness than looking for trouble. Medicine should serve you, not the other way around. Stay informed, ask the hard questions, and don't be afraid to protect your golden years from unnecessary medical interference. Because often, the secret to a healthy old age isn't more tests, it's knowing when to stop testing and just keep living. In our last discussion, we talked about the big picture, why certain medical tests that are lifesavers when you're younger can become risky after age 7. Today, we're going to zoom in on the first of these 3 tests, and it's a big one, the routine colonoscopy. This is a procedure that has been so ingrained in our minds as a must-do that questioning it can feel almost irresponsible. But when it comes to people over 75, the science and the risks tell a very different story. Let's have an honest conversation about why the automatic yes to a routine colonoscopy after 75 might not be the best answer for your health. So why does your doctor's office keep sending you those reminders? You hit 76, 78, or 80. You feel perfectly fine, and you've had normal colonoscopies in the past. Yet, like clockwork, the letter arrives telling you it's time for another. There are a couple of reasons for this, and most of them have little to do with your individual health. First, we have to acknowledge the financial aspect. A single colonoscopy can generate thousands of dollars for a hospital or clinic. It's a high-volume, profitable procedure. When a system has a financial incentive to perform a test, it tends to get recommended frequently. The other reason is simple inertia. Many medical systems operate on automated protocols that are based on outdated recommendations. The computer flags a patient as due for a screening without considering their age or previous results. It's easier for a busy clinic to follow the automated prompt than it is to have a nuanced 10-minute conversation with you about why, in your specific case, the risks might now outweigh the benefit. That conversation takes time and a deep understanding of geriatric medicine, which unfortunately isn't always prioritized. Now let's talk about those risks, because they are not trivial. and they increase significantly as we get older. The most feared complication is a bowel perforation, a tear in the colon wall. While it's rare in younger patients, the risk for seniors jumps to as high as 1 in 4. This is a life-threatening emergency that requires major surgery and can lead to a cascade of problems, from severe infections to long-term colostomy bags. I've seen vibrant, independent seniors have their lives completely derailed by this routine screening complication. Even if you avoid a perforation, the procedure itself carries other dangers. The sedation used can be hard on an older body. It can cause dangerous drops in blood pressure or trigger heart rhythm problems, especially if you have underlying cardiac issues. Many patients also experience a prolonged period of confusion or brain fog after anesthesia, which can be unsettling and interfere with daily life for weeks. But perhaps the most common and underestimated risk comes from the bowel prep itself. Preparing for a colonoscopy requires drinking large amounts of powerful laxatives to completely clean out your system. This process is designed to dehydrate you, and for a senior, that can be incredibly dangerous. This level of dehydration can lead to a severe electrolyte imbalance, causing confusion and weakness. It dramatically increases the risk of a fall, which could result in a broken hip or a head injury. For someone in their late 70s or 80s, a fall can be the event that marks the end of their independence. You go in for a test to prevent a theoretical future problem, and the preparation for the test creates a definite, immediate one. Don't just take my word for it. The research is becoming increasingly clear on this. A major study published in a top medical journal, JAMA Internal Medicine, followed over 50,000 seniors for a decade. The results were stunning. For individuals who continued to get routine colonoscopies after age 75, there was no reduction in deaths from colon cancer. Let me repeat that. Screening after 75 did not save lives. What it did do, however, was cause a significant increase in hospitalizations for complications related to the procedure. The evidence suggests we are putting seniors at risk for no measurable benefit in longevity. To understand why this is, you need to understand the medical reality of how colon cancer develops. It grows very, very slowly. From the moment a new polyp forms, it can take 10 to 15 years for it to become a dangerous cancer. So, let's do the math. If you are 78 and have had clear colonoscopies up until this point, a new polyp that forms today would likely not become a threat until you are in your... The statistical reality is that most seniors in this situation will pass away from other, more immediate causes long before that slow-growing polyp could ever harm them. We're subjecting people to present-day risks to screen for a problem that is unlikely to ever materialize in their lifetime. This all sounds quite definitive, but does it mean no one over 75 should ever get a colonoscopy? Absolutely not. The key distinction here is between routine screening and diagnostic testing. If you are asymptomatic, meaning you feel fine and have no warning signs, then a routine colonoscopy is what we are questioning. However, if you are experiencing symptoms, that is a completely different situation. A colonoscopy is absolutely the right test if you have specific symptoms that need to be investigated. These include seeing blood in your stool, which should never be ignored. It's also appropriate if you experience a major, unexplained change in your bowel habits, like persistent diarrhea or constipation that is new for you. Another critical symptom is unexplained weight loss. Losing weight without trying is a red flag your body is sending that something is wrong. In these cases, the goal of the colonoscopy is not to screen for a far-off problem, it's to diagnose a current one. The risk-benefit calculation completely changes when you have symptoms. We need to find out what is happening now. The takeaway is this: you have the power to make an informed choice. When that screening reminder comes in the mail, it's not a command, it's the start of a conversation. You can go to your doctor and say, "I understand this is a routine recommendation, but given my age and my history of clear tests, I'd like to discuss the risks versus the benefits for me personally." You can bring up the fact that colon cancer is slow-growing and that the prep and procedure carry immediate risks like dehydration, falls, and perforation. A good doctor will respect this and engage in that conversation. You have the right to prioritize your quality of life today over a screening test that research shows is unlikely to help you live longer. Your golden years are precious, and they shouldn't be spent recovering from a test you may have never needed in the first place. It is good to have you back. If you have been following along, we have been diving deep into a topic that makes a lot of people nervous, but is absolutely vital for protecting your quality of life, knowing when to say no to routine medical tests. We've already talked about the hidden risks of colonoscopies. Today, we are going to tackle the final 2 tests on our list of procedures you need to think twice about: the PSA screening for prostate cancer and the routine cardiac stress test. These are tests that doctors order almost automatically. They are tests that friends and family might tell you are essential. But the science tells us a very different story for men and women over the age of 7. Let's start with the men, and specifically the PSA test. If you are a man over 70, you know the drill. You go in for your annual checkup, they draw some blood, and they check your prostate-specific antigen levels. It seems harmless, right? It's just a blood test. How could that possibly hurt you? The danger isn't in the blood draw itself. The danger is in the cascade of events that a simple elevated number can trigger. Here is the reality that often gets left out of the exam room conversation. For many men, prostate cancer is not a death sentence. In fact, autopsy studies have shown us something fascinating and reassuring. About 60 to 70% of men over the age of 70 have prostate cancer cells in their bodies. But, and this is the crucial part, the vast majority of these men will never know it. These cells grow so incredibly slowly that they will never cause symptoms, never spread, and never shorten the man's life. We often say that most men die with prostate cancer, not from it. But when we run a PSA test and find an elevated number, the medical machine kicks into gear. We can't just ignore it, right? So the next step is a biopsy. Now we have moved from a blood test to an invasive procedure where needles are inserted into the prostate. This isn't risk-free. Between 2 and 3% of men who undergo a biopsy end up with a life-threatening infection that requires hospitalization. That is a serious gamble for a disease that likely wasn't going to hurt you. If the biopsy finds cancer cells, which, remember, are very common in older men, the pressure to treat it becomes immense. Even though the cancer might be harmless, the word cancer is terrifying. This leads to surgeries to remove the prostate or radiation therapy. And the side effects of these treatments are devastating to a man's quality of life. We are talking about permanent incontinence, needing diapers in your 70s or 80s, and erectile dysfunction. You might trade your vitality and your dignity to treat a condition that was never going to bother you in the first place. The research backs this up strongly. A massive European study followed 62,000 men and found that for those over 70, routine PSA screening did absolutely nothing to reduce the number of deaths from prostate cancer. Zero reduction. But there was a huge increase in complications from the biopsies and treatments. That is why major medical groups, including the U.S. Preventive Services Task Force and the American Cancer Society, now recommend against routine PSA screening for men over 70. So why does your doctor still order it? Often it's habit. It's an easy test to order, and frankly, it feeds a very profitable system of biopsies and surgeries. But you have the right to opt out. You can say, "Doc, I understand the risks, and I'd rather not look for something that isn't bothering me." Now let's shift gears and talk about the heart. This applies to both men and women. I want to talk about the routine cardiac stress test. Picture this: you are 74 years old, you are active, you walk the dog, you maybe play a little pickleball. You have no chest pain, no shortness of breath. You feel great. But your doctor suggests a stress test, just to be safe, maybe as part of a checkup, or before a minor surgery like a knee replacement. It sounds like a good idea, doesn't it? Better safe than sorry. Actually, in this case, safe might be the wrong word. When you perform a stress test on an older heart that is functioning perfectly well, you run into a major problem: false positives. As we age, our blood vessels naturally change. These innocent changes can look suspicious on a scan. Studies show that in older patients without symptoms, 40 to 50% of abnormal stress test results are actually false alarms. But once that alarm rings, we can't unring it. That shadow on the scan leads to an angiogram, an invasive procedure where we thread a catheter into your heart. That carries risks of bleeding, stroke, and kidney damage. And often, once we are in there, we find a partial blockage that might have been stable for years. But because we found it, we stent it. Suddenly, you are recovering from a heart procedure you didn't need. You are put on strong blood thinners for the rest of your life, which increases your risk of dangerous bleeding if you fall. And for what? A major study published in JAMA Cardiology followed 10,000 asymptomatic seniors and found that routine stress testing did not prevent heart attacks or save lives. It didn't improve outcomes at all. All it did was skyrocket the number of invasive procedures and complications. We need to be very clear about the difference between screening and diagnosis here, just like with the other tests. If you are having chest pain, if you get winded walking to the mailbox when you used to be able to walk a mile, or if you have unexplained fatigue, then absolutely get the stress test. In that case, the test is investigating a symptom. It is trying to solve a mystery. That is good medicine. But using a stress test to go fishing for problems in a healthy, active senior is bad medicine. It's looking for trouble. It generates expensive follow-up procedures like angiograms and bypass surgeries that profit the hospital system, but often leave the patient frailer and more medicated than they were before. I had a patient, let's call her Mary. She was 78, walked 2 miles a day. Her cardiologist ordered a routine stress test. It showed a minor abnormality. She ended up with a stent she didn't need, had a reaction to the blood thinners, and developed a severe bleed in her stomach. She spent 3 weeks in the hospital and never really regained her strength to walk those 2 miles again. The system tried to save her from a heart attack she wasn't having, and in the process, it took away the very activity that was keeping her heart healthy. So, what is the takeaway from all of this? It is not that you should avoid doctors. It is that you need to change the way you interact with the medical system once you pass that 70-year mark. The rules of the game change. Medicine is excellent at fixing acute problems, a broken leg, an infection, a sudden pain, but modern medicine struggles with the concept of aging naturally. It tends to treat aging as a disease to be aggressively fought, rather than a stage of life to be managed with care and wisdom. When your doctor suggests a PSA test or a stress test, and you have no symptoms, pause, take a breath. Ask the hard questions. Ask if we find something, will treating it actually make me live longer? Or will it just make me a patient? Ask what is the rate of false positives for someone my age? Refusing a test isn't giving up on your health. It is actually a very proactive way of protecting it. It is saying that you value your current quality of life, your ability to walk, to travel, to enjoy your family without catheters or side effects, more than you value a number on a chart. You are the expert on your body. You know how you feel. If you feel well, protect that wellness. Don't let a routine protocol turn you into a patient unnecessarily. Stay active, eat well, enjoy your life, and only go looking for medical trouble if trouble comes looking for you first. That is the smartest prescription I can give you. Thanks for listening. Welcome back. Over our last few sessions, we've taken a hard look at 3 medical tests that are often pushed as mandatory for seniors: the routine colonoscopy, the PSA screen, and the asymptomatic cardiac stress test. We've discussed the specific risks each one carries for people over 70 and why the potential harms can often outweigh the benefits. Today, I want to bring it all together. We'll look at the powerful evidence that supports being cautious, arm you with the exact questions to ask your doctor, and most importantly, talk about what you should be focusing on instead to live a long, healthy, and vibrant life. I know that questioning these deeply ingrained medical practices can feel a little scary. It might feel like you're going against the grain. So I want you to know that this isn't just my opinion. This is a movement in medicine backed by solid research. For example, a major analysis published in the Journal of the American Medical Association, JAMA, looked at data from thousands of older adults. Their conclusion was clear. For healthy seniors over 75, routine screenings with colonoscopies, PSA tests, and stress tests showed no mortality benefit. They didn't help people live longer. There's also a prominent campaign in the medical community called Choosing Wisely. Its entire purpose is to encourage doctors and patients to have conversations about unnecessary tests and treatments. And guess what? They specifically advise against these exact screenings in older adults who don't have symptoms. The science is so compelling that even when we look at international comparisons, we find that countries with far less aggressive screening protocols for seniors often have equal or even better health outcomes. This tells us that more testing does not automatically equal more health. Sometimes it just means more complications. So how do you put this knowledge into practice? The next time you're in an exam room and a routine test is suggested, you can become an active partner in your own healthcare by asking a few key questions. Don't be shy. Your health is what's at stake. First, ask, what is the actual chance this test will find a life-threatening condition in someone my age with my health history? This cuts through the general statistics and gets to your personal risk. Second, follow up with what are the complication rates for this procedure for someone my age. Knowing the odds of a false positive, a perforation, or an infection is just as important as knowing the odds of finding cancer. Third, and this might be the most important question of all, ask, if we do find something, will the treatment genuinely extend my life, or will it just impact my quality of life? This is the heart of the matter. Will it give you more good years, or will it turn your good years into years filled with medical appointments and side effects? Finally, you can ask, what do the official medical guidelines from groups like the U.S. Preventive Services Task Force say about this test for people in my age group? This shows you've done your homework and prompts a more evidence-based conversation. Asking these questions shifts the dynamic. You are no longer just a passive recipient of a medical order. You are an informed individual making a decision about what you are and are not willing to risk. Now, I know what you might be thinking. If I'm not focusing on all these screenings, what should I be focusing on? This is my favorite part of the conversation, because the answer is empowering. Instead of chasing down potential diseases with risky tests, you can spend your energy on evidence-based strategies that are proven to extend your healthy lifespan. The real fountain of youth isn't found in a screening lab. It's found in your daily habits. The first and simplest is walking. A daily walk does wonders for your heart, your muscles, your mood, and your mind. It's low impact and profoundly effective. Second, add some form of strength training twice a week. You don't need to become a bodybuilder. This can be lifting light weights using resistance bands or even doing body weight exercises like chair squats. Maintaining muscle mass is one of the most critical factors for staying independent and avoiding falls as you age. Third, look at your plate. Adopting a Mediterranean-style diet, rich in vegetables, fruits, healthy fats like olive oil, and lean proteins, is one of the most researched and effective ways to reduce inflammation and protect your heart and brain. Fourth, manage the numbers that matter. Keep an eye on your blood pressure and cholesterol. These are conditions that can be managed effectively with lifestyle changes and medication, and controlling them provides a much bigger benefit for your longevity than a risky, speculative screening test. And finally, don't underestimate the power of human connection. Maintaining strong social ties with family, friends, and community groups is incredibly protective of both your mental and physical health. Loneliness can be as detrimental to your health as smoking. Focusing on these 5 areas, walking, strength, diet, key vitals, and social connection, is a strategy of proactive wellness. You're not waiting for a test to tell you you're sick. You're actively building a foundation of health that makes disease less likely in the first place. This path of selective, informed care leads to far healthier aging than a path of aggressive, automatic screening. As a final thought, some of my patients ask about natural supplements that can support this healthy aging process. While these are never mandatory, some people find them helpful. For instance, L-citrulline, which is found in watermelon extract, is often used to support healthy circulation. And some seniors find that a well-formulated vitality blend can help with energy levels, hormone balance, and metabolism. Again, these are optional supports, not replacements for the core lifestyle habits we've discussed. The ultimate message I want to leave you with is one of empowerment. Your golden years should be defined by joy, freedom, and well-being, not by fear and unnecessary medical procedure. You have the right to protect your quality of life by understanding the evidence, asking the right questions, and focusing on what truly builds health. You can navigate your 70s, 80s, and beyond with confidence and vitality. Thank you for joining me on this journey.